Advocates Post-Acute Program was developed as a program to help support patients coming out of the hospital who we felt might need a little more care before they return to home. The goal is to help them get to a level where we feel they're safe to be back in the home environment, to give them the best possible medical care as well as physical therapy care. What makes the post-acute network so great is that it's a team approach, and this is what I'm most proud of. A physician works together with an APN, or an advanced practice nurse, and both providers see the patient on a regular basis. So that patient gets seen on an average 2 to 3 times a week. In addition, since we're there all of the time, somebody's in a facility nearly every day, the patient can be seen every day if that's what their medical condition requires. So we work together, seeing the patient frequently to make sure that we keep them in the best medical shape possible. This allows them, therefore, to participate in therapy, to get better and get home faster. We keep them from going back to the hospital. Our goal is to get them home and keep them well. In addition, we partner with the facility. We work hand in hand with the physical therapists, with the social workers, case managers. We work with the dietitians, respiratory therapy, all of the other people that are providing care for that patient.
My name is Deborah Madej. I've had rheumatoid arthritis for 28 years. In recent years, my joints have gotten very bad, and at times I couldn't even walk. I've had 2 knee replacements and a left foot fusion. Those are separate incidences, and I was hospitalized and then went to skilled nursing care after each time. My first experience with skilled nursing was my right knee, and that time I had an advocate program, it was very helpful. Everything went very well. And since that was my first time ever doing it, I thought, oh, this is great, and we'll always work this way. My second time, I forgot to request the advocate program, and I didn't get it, and I really never saw anyone. I never saw a doctor the whole time I was there. The nurse practitioner came in and waved to me and walked out. And I was very nervous about my pain because I tend to have probably more pain than other people. And towards the end of the week, because I wasn't able to go through my pain medicines with the doctor, I could not do my physical therapy fully. I had to do a reduced physical therapy for the last 2 days, which was very disappointing. Also, I was very concerned about going home with all these medications without talking it over with the doctor. I really felt very anxious. I was almost terrified about the last few days. Luckily, everything ended up okay, but it was not a good experience.
My role at the skilled nursing facility is I manage patient care of patients that leave the hospital. I'm able to be the first responder typically to any sort of issues that arise with any of our patients. And we have a team between a nurse practitioner and physicians where we visit these patients on a regular basis to treat any sort of acute issues and to be able to be available to the staff when things occur, as opposed to them having to wait for a physician.
The third time when I had the advocate program, I was a longer stay. It was about 3 weeks. I was non-weight bearing with the surgery I had, so it was a very different experience for me to be in a wheelchair the whole time. Carolyn really helped me a lot. That's the nurse practitioner. She helped me a lot. I also got sick with a bad cold while I was there, and she gave me all the medicine I needed and checked with me every single day to make sure I was comfortable because I was worried about the cough and that. And when I left there, I was feeling very secure about all my medications. We had gone over them, and all my pain was handled well. I was very happy with the program.
Discharge planning begins actually on the day of admission. The first step really is talking with the patient and the family about what their goals are, what they need that patient to be able to do to come home safely, or if they decide that maybe home is not a realistic goal, getting the resources they need to find what the appropriate setting is for the patient when they leave our facility. During the patient's stay, we're constantly reassessing how they're doing. Hopefully we're seeing them meet the goals that we set in the beginning to let them return home safely. And indeed, if that's the case, we try to make sure we set up appropriate care for them at home.
I had a great experience at the nursing home with the Advocate program. And arriving home within a short time, I had another great experience with the Advocate at Home program. When you're sick or need surgery, it is important to have a healthcare provider that you trust.